Lung cancer, a formidable foe. It grows silently within, often undetected until its grip tightens. For years, treatment options remained limited, a blunt sword against a cunning adversary. But the landscape is changing. Science has begun to decipher the intricate language of cancer cells, uncovering vulnerabilities. This is the realm of targeted therapies, a revolution in cancer treatment. Imagine a lock and key. Targeted therapies are like precision-engineered keys designed to fit specific molecular locks on cancer cells. These locks are called biomarkers, unique genetic alterations that drive the uncontrolled growth of cancer. By identifying these biomarkers, doctors can personalize treatment plans, using therapies that exploit the specific weaknesses of each patient's tumor. This approach marks a paradigm shift from traditional chemotherapy, which attacks all rapidly dividing cells, both cancerous and healthy. The result is often a double-edged sword, bringing debilitating side effects alongside its therapeutic benefits. Targeted therapies, in contrast, aim for a more selective approach, minimizing collateral damage to healthy tissues. The quest for targeted therapies is driven by a simple yet profound goal: to transform lung cancer from a death sentence into a manageable chronic illness. This is no longer a distant dream, but a tangible reality for many patients. As our understanding of cancer biology deepens, so too does our arsenal of targeted weapons. Unraveling the genetic secrets of lung cancer is like piecing together a complex jigsaw puzzle. Each piece, a biomarker, holds a clue to the tumor's inner workings. These biomarkers are not created equal. Some hold the key to unlocking effective targeted therapies. One such key is EGFR, a protein often found mutated in lung cancer cells. This mutation acts like a stuck accelerator, driving uncontrolled cell growth. Targeted therapies like osimertinib and gefitinib act as brakes, specifically inhibiting the activity of mutated EGFR and halting tumor growth. Another critical piece of the puzzle is the KRAS gene. Mutations in KRAS, particularly the G12C mutation, were once considered undruggable. However, recent breakthroughs have led to the development of sotorasib, a drug that directly targets KRAS G12C, offering new hope for patients with this previously untreatable mutation. Beyond EGFR and KRAS, a constellation of other biomarkers illuminates the path to personalized treatment. ALK, ROS1, ARIT, and NTRK gene fusions are like rearranged circuits, sending faulty signals that fuel cancer growth. Targeted therapies designed to disrupt these aberrant signals have shown remarkable success in shrinking tumors and improving survival. The discovery of EGFR mutations marked a turning point in lung cancer treatment. For the first time, doctors could offer patients a therapy tailored to their tumor's specific genetic makeup. This personalized approach revolutionized the field, leading to dramatic improvements in outcomes for patients with EGFR mutant lung cancer. The success of EGFR inhibitors fueled a surge in research, leading to the identification and targeting of other key drivers of lung cancer. ALK inhibitors like crizotinib and alectinib emerged as powerful weapons against tumors harboring ALK gene fusions, demonstrating remarkable efficacy in shrinking tumors and prolonging survival. The development of sotorasib, the first-in-class KRAS G12C inhibitor, marked another milestone in the field. This breakthrough shattered the long-held belief that KRAS mutations were undruggable, opening up a new avenue for targeted therapy development. But the story doesn't end there. Ongoing research continues to unravel the complexities of lung cancer genetics, identifying new biomarkers and developing novel targeted therapies. MET exon 14. Skipping mutations, for example, have emerged as another promising target, with selective MET inhibitors showing encouraging results in clinical trials. Immunotherapy, unleashing the body's defenses against lung cancer. While targeted therapies directly attack cancer cells, immunotherapy harnesses the power of the immune system to recognize and destroy these malignant invaders. Our immune system is a formidable defense force, constantly patrolling for threats. However, cancer cells often evade detection, disguising themselves as harmless entities. Immunotherapy works by removing the mask of cancer, exposing these malicious actors to the full force of the immune system. One key target is PD-L1, a protein found on the surface of some cancer cells. PD-L1 acts like a "don't eat me" signal, suppressing the immune response. Immune checkpoint inhibitors like pembrolizumab and nivolumab block this signal, unleashing the immune system's full potential against cancer. PD-L1 expression levels are used as a biomarker to identify patients who are most likely to benefit from immunotherapy. Patients with high PD-L1 expression tend to respond better to checkpoint inhibitors, experiencing significant tumor shrinkage and improved survival. However, even patients with low PD-L1 expression can benefit from immunotherapy, highlighting the complex interplay between cancer and the immune system. The advent of immunotherapy has been a game changer in lung cancer treatment, offering new hope for patients who have exhausted other options. Combinations of immunotherapy and targeted therapies are showing even greater promise, pushing the boundaries of cancer treatment and paving the way for a future where more patients can live longer, healthier lives. The future of lung cancer treatment, progress, and promise. The landscape of lung cancer treatment has been irrevocably altered by the arrival of targeted therapies and immunotherapy. What was once a bleak prognosis has transformed into a beacon of hope for many patients. The future holds immense promise as we continue to decode the complexities of cancer biology and develop even more precise and effective treatments. Ongoing research is exploring new biomarkers and therapeutic targets, aiming to expand the reach of personalized medicine. Liquid biopsies, which analyze tumor DNA circulating in the blood, offer a minimally invasive way to monitor treatment response and detect emerging mutations. The development of novel drug combinations, including targeted therapies, immunotherapy, and chemotherapy, holds the potential to further improve outcomes by attacking cancer from multiple angles. Clinical trials are ongoing to evaluate the safety and efficacy of these innovative treatment approaches. The fight against lung cancer is far from over. However, armed with the knowledge gleaned from the human genome and driven by relentless scientific inquiry, we are entering a new era of cancer treatment, an era defined by hope, progress, and the promise of a future where lung cancer is no longer a death sentence, but a chronic illness that can be effectively managed, allowing patients to live longer, healthier lives.